Welcome to the broadcast. Please post your comments and answers to the following question below. The question is, why is free healthcare considered such a bad thing in America? Here are the answers we have compiled. Because it is not good and nothing is really free. Get a job and pay for what you want out of life. Why depend on someone else sitting in an office somewhere deciding your health care and what care you need or do not need and get? Get an education, a job, and pay for it. Because it's not free at all. It just means you get to pay for your neighbor's insurance while he pays for yours. It also means you end up paying for some freeloader and someone working harder than you has to pay for you. Also, we don't give money away to defense contractors. They provide the government a service, and then the government takes our money and gives it to the contractor. Then most of this money is spent paying for useless nations like most of the EU, who can get subsidized by not having to pay for their own military. Funny how that works, but still, it does grant the US power. Calling something free leaves you open to a lot of ridicule. The cost, hint, it isn't free. The quality, hint, it isn't good. The majority of the world doesn't have 300 million people in their country. Many in America are greedy assholes who are against their tax dollars being used to help the less fortunate. The healthcare system is designed solely for con people and profit. Because people are convinced their taxes will go through the roof with it. Free healthcare just means that somebody else has to pay for it. This is a good one. 2 doctors and an HMO manager died and lined up at the pearly gates for admission into heaven. St. Peter asked them to identify themselves. One doctor stepped forward and said, "I was a pediatric spine surgeon and helped kids overcome their deformities." St. Peter said, "You may enter." The second doctor said, "I was a psychiatrist. I helped people rehabilitate themselves." St. Peter invited him into heaven also. The third applicant stepped forward and said, "I was an HMO manager." St. Peter said, "You can come in also." But as the HMO manager walked by, St. Peter added, "You may stay for 3 days. After that, you know where you can go." Why do you suppose the majority of the free world wants to come here for their medical procedures then, when they have it free where they are? The term free is the problem. The question is how we ensure quality health care at the lowest per capita cost. Smart people pay their own way and stay healthy. Free? Maybe because we oppose slavery. Do you support slavery? Forced labor? There is no country on earth that offers free health care. It simply depends on how you pay for the health care. The United States government already pays the 3rd most per capita of any country in the world on health care without having a national health care system. Implementing one will skyrocket the cost and eliminate choices in health care treatment. Just go to the hospital and you get free health care, so health care does exist in America for legals and illegals. Because free health care is substandard health care. The quality of free health care is bad. Been there, done that. Republican politicians receive millions in campaign donations from Big Pharma. Not to mention they have millions invested in Big Pharma and healthcare companies to boot. They would lose lots of money if healthcare was free. The good thing about a private system is that it provides the best quality. The problem is that it doesn't provide equality. It's the best system for those who can afford it. There's also the fact that these other countries pay massive taxes for their health care that most Americans simply don't want to pay. Added to this is the significant foreign aid we give to many of these countries, which makes it easier for them to pay for health care. 90% of Americans are insured. Imagine removing 290,000 of them from their health care insurance and cramming them all into public hospitals, clinics, or a mercy ship. Imagine 5,000 people on a ship all waiting to get seen by 5 doctors in the ship's medical infirmary. Private practitioners will likely stop practicing. Private hospitals and clinics close due to the cost. Low income, extreme overcrowding, and fatigue. What will happen to quality of care and cost? We are the land of the free and the home of the brave, not the home of the slave. Anyone who has ever dealt with Medicare has to know that Medicare for all looks good on paper, but there are a lot of sneaky loopholes. First off, it only pays 80% of approved procedures, leaving you to pay the other 20%, or 100% if what isn't approved, which is actually happening more lately. Medical professionals don't have time to think of the cheapest option to treat the patient or keep track of what is and isn't covered. Seniors are less likely to keep track of their treatment and who is charging what for their care. Medicare fraud is already a lucrative business, ripping off seniors for procedures and equipment they don't need or didn't get. Unless they get that under control, making the whole country participate is going to be an even bigger problem than it is now. Medicare supplement insurance is a huge business. They aren't interested in fixing the problems because they're raking it in. The medical insurance and corporate healthcare industries are poisoned from the top down. They are more interested in the bottom line for their stockholders than they are being able to provide quality health care. Newsflash: healthcare in the United States is a money-making business run by corporations. As far as they are concerned, they want you to be sick. You pay your insurance premium out of every paycheck. Your employer may or may not contribute. Then when you go to the doctor, you still pay a copay just to be seen. Then they run test after test. Next thing you know, they send a bill to your insurance, who in return refuses to pay what the doctor's fee was, even though they were in an approved providers list. Guess who pays the difference? You do, my friend. It's such a racket of organized crime. Meanwhile, they probably have cures for many ailments, but the FDA ties it all up in red tape. The drug companies just want to get rich off people suffering anyway. Why do the same medications here cost so much less in Canada or Europe? How does our government allow this to happen? That and this is why it's not free. It isn't that free healthcare is bad, it's that the way it would be done here is bad. It would probably be like Canada, where you aren't allowed to pay for your own healthcare even if the government refuses to cover something. And yes, that actually happens. My grandpa knew a guy in Canada who had to buy his medication on the black market because it was insanely expensive, and a council had to meet to approve it, but it was the weekend and he would die before the council could meet if he didn't get the medicine right away. That's pathetic. There is no such thing as free healthcare. A doctor is a person that is very specially talented and chooses to spend 8 years or more getting a degree and then building his experience, and for that, compensation is required. You can say they make too much, but then who will choose that path? No especially talented people. Hospitals cost money to run and require amenities that most businesses do not, like an uninterruptible clean power source for that building. Advanced equipment for which failure is not an option, as failure can literally kill, and in so doing cost millions in lawsuits. How can anyone fathom that healthcare could ever be free? Even if we managed to find the most talented people and enslave them to train and then work for free, how would you feed them and clothe them for free? How create the most advanced equipment in the world for free? Nonsense. The quality of healthcare in America is based on your income, and many wealthy Americans want to keep it that way. Watch the movie John Q, and you will see how brutal and heartless our healthcare system really is. We have money for wars, but we have no shame letting someone die. If it was free, hospitals and doctors couldn't upcharge for special treatments. Thanks for watching the broadcast. Please leave your comments and answers below.